Hyperbaric oxygen therapy has been used for decades in hospital burn units, but now a new clinic in Dallas is using it to treat everything from sports injuries to autism. But does it work, and is it worth the money? CBS 11's Melissa Newton has details.
When Kimberly Myers broke her arm last October, the high school volleyball player found herself on the bench.
He told me that worst case I wouldn't play for 6 to 9 months with the possibility of never playing again.
But 2.5 months later, she was back on the court.
Well, the doctor is pretty amazed.
She is one of a growing number of high school athletes using hyperbaric oxygen therapy to speed up healing. David Allen is another.
It just makes the process a whole lot faster.
Hyperbarics has proven over 60 years that it reduces inflammation and accelerates healing.
Primarily, we're treating muscle injuries, soft tissue injuries. We have fractures. We have treated patients with cartilage injuries.
Texas Rangers outfielder Josh Hamilton used a hyperbaric oxygen chamber last season when he cracked his ribs.
And I really think that it helped me get back fast for the playoffs.
And basically, they roll you into the chamber, close the door, and then pressurize it with 100% oxygen. Then you just lay back, relax, and watch TV for an hour.
Many of our patients are athletes who are involved in sporting accidents, sporting injuries. Sometimes it can even be normal wear and tear from the rigorous things that they do while playing their sports. In Tyler's case, he had an injury to his knee, and even though it was surgically repaired, he had a torn anterior and posterior cruciate, and we know that improving the oxygen delivery to these oxygen-starved tissues will increase the rate of healing by providing high-pressure oxygen to those structures.
Well, it was the last game of the year, and it was a kick return, and I was running the ball, and my leg got caught, and it snapped back. And I hurt my LCL, my ACL, my PCL, and I tore the muscle off my bone. And I came here, and Dr. Surya did my surgery.
We feel very fortunate that we have access to a place like this so that our patients, whether they're recreational, high school, or professional, can take advantage of this technology. In this particular case, this is a young man with Division I prospects that had a complete knee blowout playing football. So the surgery was to reconstruct almost everything in the back of the knee. He also had some nerve damage. It was very clear to me after we did the surgery that he will really benefit from hyperbaric oxygen treatments.
We've had cases where people have been told they wouldn't play for 6 months, but have been back playing their sports in 2.5 to 3 months because of the accelerated healing from the hyperbaric oxygen.
I've been coming to therapy for like 5 days, and it's speeding up my recovery, and it's healing real fast.
We've realized that more and more people would benefit from hyperbaric oxygen therapy to accelerate their healing after sporting injuries, after soft tissue injuries.
Normally there's a lot of swelling and bleeding and bruising, and in this particular case I haven't seen any. That's either because I'm a really, really good surgeon or we're really getting some benefit from this hyperbaric oxygen.
Recently, Jason Kidd had what his surgeon calls a lower back strain. The lower back is a complex mesh of tendons, ligaments, and muscles, all of which heal better with high-pressure oxygen.
I've had back problems, I've had knee problems, feet, in the sense of just being able to come in and understand that you will feel better leaving here, but also it does work. The more that you do it, you see the response in your body.
With high-pressure oxygen, we provide oxygen to the entire body by putting the athlete in a chamber under pressure, roughly 15 pounds per square inch. What this does is force oxygen into not just the bloodstream, but all of the tissues in the body to promote healing, to help these cells function better.
I've been doing the hyperbaric for 3 years now, and it's helped me stay in the league at my age, and also it's just made me feel a lot better as a person just understanding the aches and pains of our job has helped take away those aches and pains and made me feel younger.
No one heals faster than a 16, 17, 18-year-old. You know, that's when we heal the fastest. When you're in your 20s or 30s, you find that when you're playing 2 games in 2 days, or for football players, when you're getting concussions and bruises and getting hit in the football field, that you don't recover as quickly from these trauma, from these contusions, as you do when you're younger.
Being on the road, we don't have the opportunity to come in and get treatment, so you can see the difference when you might feel tired or you're a little bit banged up and you don't have the opportunity to come in.
We have had many professional athletes come in and use hyperbaric oxygen to speed the healing of these damaged tissues and help them recover from the effects of their highly competitive, highly energetic sports.
You know, as a younger player, I didn't have this luxury or this opportunity to, you know, take care of my body. And now later in my career, to be able to do this has helped me, you know, stay in the league. And I'm very blessed to have this opportunity to come here and do these treatments. And hopefully it'll keep me in the league a little bit longer.